There we go. We're
So
going.
good morning, everybody. I love this classroom. How's everybody doing? Yeah, good. All right. So my name is Dr. Dorie Weaver. I've been in the nursing program. It'll be 6 years now. I teach at all levels, our undergrads. I teach graduate and the DNP, our doctorate program as well. And I brought 3 lovely students who are willing to get up early. They didn't have to, but to come and talk to you, because I do know that it's going to make more sense, or you're going to probably believe them a little bit more than me, because they're living this right now. So let me say your name wrong. Tyasia. This is Tyasia. This is Joshua, and I have Hannah. Okay. Joshua and Hannah are junior 2s, which means they finished junior 1.
Yeah, we're in our second semester.
They're in their second semester of the nursing program. And then Tyasia is in her first semester. Okay, so I brought them here because when I say the nursing program is rigorous, intense, I'm not exaggerating at all. Okay, it's extremely intense. Some of that free time you have, you'll lose it. Okay, so and I just like to be straightforward, not to scare you or anything like that. You'll find the professors are very approachable. You know, most of us have an open door policy, things like that. So don't be afraid. But I think it's good to know what you're getting into. Okay, so one of the things I do start with is our grading scale. And everybody can hear me okay, right? Okay. Our grading scale, I don't know if you know this, is different. Okay, so you can, you have to have a 79.5 minimum to pass the course. Okay, that's our C, 79.5. Anything under that, you fail the course. You can only fail 2 courses. Okay, so essentially you can only repeat 1 course. If you fail a second course, then you're dismissed from the program. Now, keep in mind, these are not my rules, these are department rules. Okay, you can request to get readmitted. You write a lovely letter, go to one of our, our committee, and then we decide, based on the circumstances, if you should be readmitted or not. If you do get readmitted, if you fail another course, you're automatically out. Okay, it is rigorous. It is very, very rigorous. How many are morning people? Awesome. Okay. Because we also have clinicals. Clinicals do start in the first semester. Okay. And now we start in the lab at first. That's not too bad. But when we go to the hospital, you start at 6:30 a.m. So if you're driving far, that means some of our students are like literally leaving their house at 4:30 in the morning. All right. And some of these are 8-10 hour days. Okay. So I'm trying to pick on a few things here. How many are you going to start in the spring? Okay. Have you applied? Check, because the deadline is on October 1st.
I have a question. So say your references aren't in by the deadline, you still
I mean, get them in as soon as you can. We do know that sometimes you don't have control over when people write your references, but you can they might send you an email saying we're missing this, we're missing this. All right, and it's good to keep in touch with the nursing department as well, saying, did you get all my references? Okay.
That actually happened to me last year in December when I was applying. One of my references, she changed jobs, and so her email address changed, so it didn't go to the right email. So it was like 2 weeks after applications were due, and somebody from the department emailed me. I was like, hey, we can't get a hold of this reference. Can you please have her call us? So they'll contact you about it. If they don't get back to you, don't worry about it.
Yeah.
And just talk to your references. Make sure you have that communication there. It's a great thing to have a
communications, who your references are as well. Said, hey, just want to prompt you a little bit to get that in
Yeah,
there.
they may have forgotten or whatever. You know, make sure you have at least, and correct me if I'm wrong, at least one professor. Okay? I think it's still one professor.
I'm different because I was,
You're.
I had
20 years
two professors from my first university that I attended, and then a former boss, but I definitely, like your physiology
family.
professor would be a great person to have as a reference,
break the
or your
law.
anatomy professor, someone like in the science, especially like the biology area would be a great reference.
Right, and that, you bring up a good point. So anatomy, microbiology, and physiology are your key courses, okay, that we will look at as far as your grades. Okay, I know you took biology 1, 5, and math, and it's not that we don't look at those, but the 3 that I just mentioned, we will look at those. You have to have a 2.6 in those, combined in those courses, all right? We do know if you repeated, okay, so we look at that as well. But that doesn't deter, you know, that doesn't say, oh, we repeated it, we're not gonna do it. Okay. Sometimes people repeat courses simply to get an A, you know, so,
along those lines as well, those are your courses that everything builds on.
I was just gonna say that,
nursing,
yeah.
everything.
I teach pharmacology. I'm gonna say that, you know, Dr. Bill and I, it's nice because I know what she's teaching you. And I mean, she's spot on. She's spot on. And so what's nice is you can't tell me you didn't get it. Because I know you get it. Okay. And she's really, truly, honestly, you know, I'm saying this because she's here. She is truly preparing you, okay, for what's coming up next. It's very fast paced. Think about it. We're doing this in 4 semesters. Some people know most nursing programs, not know, but a fair amount are, you know, 3 years instead of 2 years. Okay, so it is very fast paced. Your first semester, you take 4 pretty difficult courses, don't you think?
They're long courses too. If you think it's boring to sit through an hour-long lecture, you have 2 and 3 hour lectures when you get into nursing school. It gets tedious. It's hard to stay awake sometimes. Not in your class. Not yours. I have to, or else I won't pass. I stay awake in your class.
I dance, I try to be animated. You know, who doesn't like drugs? I mean, not to do them, don't do them.
We're getting the good stuff.
It is, the great thing about it though is it's only 2 days. So you have 2 days of classes and then you have 1 day of, clinical
And Wednesday.
and then a lab, right? So that works out well. That's why like in junior 2, we have 2 days of classes and 2 clinicals. That's the reason why Hannah and I can be here today is because Friday's our day off. We actually have Friday and Monday off, but we have to go to clinical on Saturday. So your schedule, you have to be flexible. That's one of the things is, and that's a great learning tool just in life as well, as being flexible and going, well, I don't always get to do my Friday nights the way I want to do them or whatever. Yeah, that's just the way it goes. It's only 2 more years. You can get through it.
Going back to the clinical starting at 6:30, that means you are on the floor with whatever you're going to be taking notes with, your stethoscope, your pen light, everything ready to go at 6:30. That's not pulling into the parking lot at McLeod or MUSC at 6:30. I know Josh and I are in the same clinical on Wednesdays. And both of us are usually at McLeod by 5 after, 10 after, 6 in the morning. Josh gets there before I do. But I don't play at the hospital until 6. Yes, so it's not like
Starbucks opens at 6. I'm the first in line.
it's not pulling in at 6:30, walking to your floor. It is on your floor, ready to go by 6:30. Because once you start, it is kind of, I mean, it depends on the day. Sometimes it's a slow day on whatever floor you're on. Sometimes it's busy, but you are not, not on your phone, not messing around, not just standing. You should be trying to learn as much as you can.
The phone in the
Yeah, right.
Tomorrow is so tempting and, we'll write you up, on your phone. And you can only get 3 write-ups and you're done. You're dismissed from the program. Okay, and they're cumulative. So it could be, maybe you want to, you smart mouth me, I didn't like it. I certainly that's unprofessional behavior, right? So I can write you up. Then now you come to clinical the next day, I'm prepared, When I say I'm prepared, that's what you talk about your stethoscope. I mean, that's a part of you that you don't ever forget your stethoscope. Because some professors with it, you'll be sent home and it's a write-up. We have had lost junior ones because of just write-ups. They came in late, they were unprofessional.
Unkept.
Yeah, yep. So, I mean, I know I don't want, again, I'm not trying to scare you. We're really not meaning, but we do have to follow the protocol. Things do happen though. You get a flat tire on your way to clinical. You don't know you're gonna get a flat tire. You just have to email. We all have our emails on our phone. So you just have to email us. Because one big thing is, I know I worry. If my students are not there, I think the worst. Oh my gosh, we're in a car accident, So that's just a public, please let me know. Now, if it's a pattern that you get a flat tire every other week. One, you might want to look at getting tired somewhere else, but I've had students say their grandmother died 6 times. I mean, I guess they think we don't really communicate or we forget about, but no. Yeah, I could tell you some more stories, but I'm not. Oh,
Know that the nursing staff, the nursing department's small. It's not huge. They all know each other. So you just got to remember that as well. Just to kind of give you guys not a heads up, but a little bit of knowledge about us as well. Josh, right? I am a 2nd degree seeking student. So I am, I was in, anybody 2nd degree?
I thought we might have one.
Yeah, so
Sorry.
I was in your place like 20 years ago, sadly. And I'm an,
That old, huh?
yeah, I am. Yeah, actually, it was about 20 years ago when I was in physiology. So I wish I would have had this class like immediately going into it because it would have helped me. Like I am now catching up. So I'm an athletic trainer as well. That's what I did in my first life. And then just decided, well, COVID decided for me that it was time to come back. So I just wanted to kind of give you that basis of who I am and that I'm a 2nd degree seeking student. So I may have a different perspective on it than these ladies over here do.
But you can speak about.
Oh, yeah.
Your 1st degree, how different that was. Our testing is completely different than what you're used to. Okay, you want to.
The biggest question is the questions that still get me to this day on these exams, and I am going into we have our 2nd exam for psych on Tuesday next week, our select all and apply. So it's multiple choice, but it's multiple. So
Yeah,
those ones are not fun for me.
Do you still have the questions like these are all right, but which one's the most right?
Yes,
Yeah.
yes,
Yeah.
yes. And it frustrates the heck out of me.
Right.
Because you're like, they're all there.
Yeah,
What's priority?
What is the biggest?
yeah, there's one key word or one key phrase in
Who's
that
dying first?
question that you have to answer.
Who's going to die first?
Well, and you can only do one thing, you can only say one word. So that's how you're thinking. And we teach you how to think like that. But you're also teaching yourself how to think like that. So truly, there could be 3 or 4 correct options there, but you can only pick one. So now you got to go back and say, what the heck is Dr. Weaver asking? And it goes back. And sometimes it is priority, and sometimes if you read it too fast, you miss one key word. Or if you don't read the entire option, a lot of students do that. They see one part of the option, okay, that's it. But purposely, I took a 14-week class on how to write NCLEX. And I am an item writer for NCLEX, waiting for the card. Yeah. Oh,
I
we
didn't
didn't?
know that, no.
Well,
We need to talk.
and I taught at FMU for years, but, you know, we have to design the questions so that it's almost like we're tricking you. We have to write them where it's kind of entice students to kind of lean towards the wrong way. I know that sounds horrible. I don't make any class up. I don't, you know, I assist them maybe, but I can't change what they do. So it is entirely probably different. It's so hard to explain, but when you see your first pass, and maybe when you see your first grade, it might be a little shocking. But it's really hard. It's not memorization, it's applying it now. Okay.
One of the great things about it too is the fact that when you study, one of the things that, so Hannah and I are in a study group with one other student, and that, first of all, test taking tip or nurse taking tip, nurse tip, whatever, get a group, find your group, find your study group. That,
Not say that for everyone.
maybe not everybody. For us, that was the
If that is
thing.
what works for you, like learn your learning style, learn what
There you go.
how you learn this, and then apply that. And it's really important to know, I would try to know before I got in the nursing program, what my learning style is, because trying to figure out why you're in this.
But just the great thing about these tests, there's not many, but here's one of them, is
Hold
that,
that thought too, 85% of our course has to be exams.
One of our classes, for our 4 unit exams are 17% of our grade, and our final, which is cumulative of the entire semester, is 20%.
that's in junior two.
That's that's junior 2. It's a little different for junior 1. I know a lot of the junior 1 teachers try to kind of weight them higher as they go throughout the semester. Also, Dr. Weaver is going to be your best friend because she doesn't do cumulative finals, and it's amazing.
Just for
Don't tell
you-
them
just
that.
for junior.
Unless you change. Oh, no.
Junior two attention, but you guys are safe.
Okay.
How many chapters are on exam?
Depends.
Oh, about 9.
Well, it depends, from test to test and from class to class. Josh and I just took our first adult health, 1 exam last Thursday, and it was 3 chapters. One of our PowerPoints was almost 200 slides on 1 chapter.
Yeah.
So just because it's 3 chapters doesn't mean it's gonna be
Yeah.
condensed to small
Yeah,
amounts of
lengthy.
content. It's gonna be a lot of in-depth stuff. With Dr. Weaver, it's a little different. It's usually more like
7 or
4, between 4 and 7
Yeah, but my
chapters.
chapters are small.
That is true.
But what I was saying was that the great thing about the tests are you're going to have the answer in front of you. You do not have to regurgitate that answer. You have to know the answer, right? So when you're studying, think about that, and that when the way I study, the way we study is we're always trying to figure out, we're trying to pull out of the air, this is the answer. So I'm asking you this question, this is the answer. The test, you have the answer right in front of you. Every single test, you have the answer right there in front of you. You just have to go, which one's the answer though, right? So you don't have to come with it from nothing, out of thin air. It's always right there. That was something that kind of went, whoa, okay.
Yeah, and you eliminate, you know, sometimes, very rarely, at least for mine, very rarely you're gonna have an answer option that's the most ridiculous one, you know, it's not the answer. Because then it's not plausible. We have to make them plausible. There's also, and tonight I just took it, there's a dosage calc, how many like math? Raising up high, how many like math? Well, I just want to tell you, start to learn, start to love it, okay? Because you have to take a dosage calculation exam. They're actually doing it this morning, and you get 2 tries. And you have to earn a 90% on it. And you just took it.
80%. You can kill 2 people.
Yeah.
No, it's a 90, it's a 9. There's 20 questions.
It's 90.
Oh, 20, yeah, that's right, that's right. You can kill 2 patients at 5 points apiece. See, we're not good at math. Sorry, you're right.
I didn't pass my first try on the calculation exam. I missed 1 more question than I could. And I cried in front of Dr. Middleton because I was so beside myself. I was stressed out. I didn't know what I was gonna do. But you just have to roll with it. I went in, took my second try. Dr. Weaver was there when Dr. Milton told me I passed. I cried again.
And I cried.
But she literally just walked out of it right before coming here. She literally just walked out of that exam. So, and I
It's
went.
not so bad.
Oh,
I mean, I tell everybody that's my opinion though, I love math. It's not that bad. It's more so the anxiety that gets people. So I try to tell everybody,
Definitely.
calm down before you take it. But yeah, and if you don't make the 90, you get withdrawn from the class. If you don't make it on the second try, you get withdrawn and you have to try again.
So that, and that's just that class, fundamental. You can continue in health assessment, pharmacology 1, and pathophysiology. Okay, but you have to drop the fundamentals course.
It would be very, very, very fundamental. I'm just reading this to know physiology inside and out. Like literally take this class as if you're already in the nursing program and this is a nursing class and learn this information inside and out. Like it's in every course that you take, and it would have been helpful if I had taken it more seriously, but especially in pathophysiology, because pathophysiology is like a deeper physiology. So if you don't know this class, you're having to learn physiology and the patho. So take this class. It's
Yes, like, so we talk a lot about what?
We talk a lot about
Muscarinic receptors,
acetylcholine.
acetylcholine,
Mhm.
epinephrine, norepinephrine, dopamine.
Lots.
Your adrenergic receptors, your betas, your alpha 1, your alpha 2, beta 1, beta 2. Does that ring a bell? Right.
It's gonna ring bells for the rest of your life.
Keep reviewing it.
But no, if you just keep, and even they had the summer off. So, and when we started talking about, really I was only at the muscarinic, and they were looking at me, and I said, come on, you only had 3 months off.
Yeah.
I said,
only
yeah,
got-
but
only
go
3.
back and review, you have to go back and review, we build on that.
Keep all your notes, like from this class, and when you get into nursing, keep all your notes. I feel like a hoarder because I just have stacks on stacks of notebooks printed off paper, especially from farm, but I have it to refer back to if I can't remember something about the
Yeah,
anticholinergic receptors. Yeah. all that
and so there's, I don't know how many body textbooks, I'll be honest, there's certain textbooks I would suggest that you buy. I'm gonna be biased. Pharmacology, first of all, there's 2 courses in pharmacology, use the same textbook. Okay, so, but it's a book that you could use as a resource and go back, in adult health or.
And so it's a good doorstop too. These textbooks are
It
huge.
is.
They are massive. They are huge textbooks, but they're very useful.
Yeah, and then, so we have 3, they're called adult health, the med surgical courses. Definitely want to buy that book, because that's 3 courses that use, 3 courses that
that
use
big.
that book.
Something like that.
It is huge, it is huge. Mine's not that big.
If you ever have it's a ganglion cyst, that's a great way to kill that ganglion cyst. Sorry.
Let's see, this is a quiz actually I gave my UL 100. Oh. It's based on the nursing student handbook. So I brought it so I can remember certain things. We talked about the grading scale. We do not round our grades. They get round. So at the end, if you're sitting with I hate to say this, and it breaks our hearts. We don't think we're cold-hearted at all. There's many sleepless nights I've had over weeks. Where you're at a 79 point.
Or you can be at a 79.4 and that's a fail.
Yeah, so I know someone who was 79.44. Oh, and there was nothing.
And I'll tell you one other thing too is, not to,
Yeah, this is nothing, we don't certainly want to scare you.
just being real,
Yeah, exactly.
just being real. Study guides and test maps don't exist in the nursing program anymore.
That's a good, yeah.
Key concepts in the book. Not anymore. So it's very important to learn how your teacher, your professor. One of the great things about college is you learn. So another caveat here is I used to teach college as well, and high school. Learn how your teacher teaches and how your teacher tests you, right? Once you figure that out, still trying to figure that one out on some people, right? Once you figure that out, you know how to study, right? You know how to take that test. You know what that person is going to ask you, how they're going to ask you, how they set their slides up, their notes up, or their output for you. They set it up in such a way that, okay, so this is what you need to know, right? So like in the past, people would give a test map and say, okay, you probably need to know this, you probably need to know this, you probably need to know this. And then you get to the test and boom, there's your questions based on what you need to know. Since they don't do that anymore, they are trying to help us and saying, like in class, you might be like, hey, look, I've gone over muscarinic receptors for this 14 times. That's probably something I'd need to remember. It's probably something I want to write down. Or something's underlined and bolded. Probably something I need to know. Or one of the great things about Dr. Weaver is that if we're talking about drugs, if you've got a drug that gives you these side effects or whatever, and all the side effects are the same as every other drug in that thing, but you got one wild side effect, guess which one you're going to be tested on? Likely. They're all the same. I can't give you the right answer because they're all the same. But if there's that one weird thing to remember, there's your weird thing to remember. So, and that's across the board too. So that's with patho, that's with fundies, which fundies is a completely different class too. Completely
That's a
different class.
different way of thinking.
Yeah.
Fundamentals is,
Shifting your brain.
yeah, it's very much a class in teaching you how to follow rules, and that it isn't always okay if you don't follow those rules. Josh can attest to this. We had last year for us, we had to submit screenshots of assignments to get credit for them, and Dr. Middleton wanted the screenshots in a very specific way. So you could see the name, see the assignment, screenshot, upload, cool.
Took me 4 weeks.
My good friend Josh didn't get credit for it. Didn't he like not get credit for one of them? Because it was submitted incorrectly. And she gave us warning after warning email and would say in class, make sure you're reading how I want this submitted. And she got fed up at the end and was like, you guys need to learn how to read. Because when you get to the hospital, like you are following, as students, we're following the direction of our preceptor that we're working under. We're following the directions of the nurse that is taking care of the patient you get assigned and of all of the other higher ups at the hospital. So it's definitely a class in learning how to follow directions and not complain about them.
In all our tests, I don't know if there's all of our tests are computerized. So you absolutely have to have a laptop. Okay. We use a security system that is called Respondus. So that means you cannot have anything open on your computer. It will not open. So it will not allow you in exam. Even though our courses are 2 and 3 hours, there's still time. You're not going to get that much time.
And when you take the exam, if you answer the question and you click next, you cannot go back.
Good point.
Once you leave a question, that's it. Like,
There's no back.
and I'm very bad about that because I'm a fast test taker. Like, I have to test fast. If I try to go slow, I overthink. But I had to slow down upon being in the nursing program because sometimes I move too fast and I might miss a word and answer it. And then as soon as I click next, I'm like, oh wait, that's not what it was asking. So yeah, once you leave that question, you cannot go back.
Yeah, and that's the way
sucks.
boards are. So different, because you have to take that national licensure exam, or you can't practice. So we set it up similar to that. I hate to bring this up. It is changing. Next generation is going to be harder. And I have to tell you that because we're in the process of changing most of our tests. And you guys won't see that because you're not taking that. But they're a lot more, they're not multiple choice. You'll see multiple choice, you'll see multiple, select all that apply. But they have things, and I won't get into that. You'll get an arrangement. We try to set that up. We're working on it with the chair and the dean, because I'm thinking that it's best if you come in a little earlier than courses start, get at least a 2-day, maybe 3-day orientation. Right, because we really want you up and running when you start classes. So that's in the works. So we're hoping to have it up by spring. That's our goal.
So forget what we said about the test then.
Yeah, well, no, there's still multiple,
Somewhat.
it's still gonna be the same way, it's still multiple choice, like all the one. They have weird names on them. They're, clothes and bow tie and, unfolding case studies. Unfolding case studies. I mean, then you have to prioritize, is this immediate, is this not immediate, is it not even, is it irrelevant? It's a lot harder. So the reason I say that is because the students that have taken the NCLEX just recently, they get to do, they're asked, will you participate in this research? Because they're trialing these questions out. Well, they don't want to say no, and I know why they're not saying no. They don't want to say no because they're afraid they'll fail the board if they say no. I would have done the same thing. So they're trying, I've had several, probably about 8 students say they were a lot harder than the ones they just took on their own board. And they didn't count. They were just, it was just like a study they were doing.
So thank those students when you get up there and you have to take it, because they probably are like, oh, okay, so we maybe need to back this down a little bit.
Yeah, I mean, because they were gonna have you memorize dosages of medications. That's crazy. That would be a lot. They took that out. So it's still in the works, but it is gonna be up for our junior ones right now, that they will be the first ones to take it.
So junior 1 ends up being fundamentals, pathophysiology, pharmacology 1, and health assessment 1, or health assessment. 4 classes that are kind of your foundation of nursing. Health assessment, why do you think health assessment? Well, it's because you have to be able to assess a patient. You have to be able to take blood pressure. You have to be able to take temperature and know how to speak to another human being when they're sick, right? That's that. Fundamentals kind of does that same thing like Hannah said. It's also a class based on learning how to follow directions. There's your tip for that class. I have sent that on Facebook. Dr. Middleton has a Facebook page. She started a mentoring program this year that's phenomenal. And I've told everybody that I've told, or that's asked me, hey, what's your tip for this class? Follow directions. Follow directions. Like I said, it took me a while to figure it out. I'm older. I'm not as technologically advanced as most of y'all are. So it took me a little while to take screenshots the way it was supposed to be. There's an assignment that's going to be due every week. And I think from now it's going to be due every week for you up until.
One assignment? No, every week you're gonna have like 5 assignments.
Well, I'm talking about DocuCare specifically.
You got DocuCare, you got VCM, you got
They got more
Preview,
now.
you
Yeah.
got, she added
Yeah.
clinical case studies this semester,
So
journals, yeah.
with
it's a lot. It's a lot.
DocuCare specifically, this one is all on how you document. And it seems tedious. It's the same thing. Everybody says it. We all said it last semester. It seems so tedious. But the great thing about it is once you get into that groove of figuring out, oh, this is how you do this, it's a lot easier to get through it later on. And it's one of those things that's like, all right, let me just sit down and do it. I tell you, honestly, I sat down with whatever was playing The Outlander or Grey's Anatomy or whatever it was playing on TV, and I'm sitting here filling out this documentation for a virtual simulation that I had just done. It's long, but the thing is, it is to teach you how to not forget something. Because what if you forget a patient's medicine? Just like we were talking about the no take backs on the test, you can't suck medicine back up from that syringe once you put it in, right? So you got to make your decision. You gotta be bold in your decision too sometimes. So that's kind of what this is. It's just teaching you, be confident in where you're at, do it, and it's helping you out with all of that. So,
Well, you're fully accountable, just so y'all know. It's not a matter of following orders. Right. If they write a drug and they give the wrong dose, they write the wrong dose, and you give it, you're fully accountable. Okay, we're not little handmaidens. So I bring up assessment because I teach advanced health assessment, but I also taught undergrad, not here at FMU, but I teach advanced patho and advanced health assessment. But I lost my train of thought. Oh dear.
you teach assessment and you're
Yeah,
not,
that's on.
you're not, you're fully accountable. Dr. Stevens?
Yeah, and I'm a family nurse practitioner, and I'm just finishing, your schooling never ends. I'm literally gonna finish my psychiatric mental health nurse practitioner degree, by the end of October. So, that's my God. No, I love school, I really do. I would, if I was young, I'd just keep going. But, your assessment skills, because you brought up assessment skills, if you call me and you're telling me I'm just making this up, that they have wheezes, I'm gonna treat it differently than if they have, rails or practice. Rails anymore. Okay, so you have to be on, spot on with your assessment, because I'm gonna be on the phone with you. Okay, I'm counting on your assessment skills. Okay, so if you're saying, this is what's going on and you're inaccurate, and then I treat it incorrectly, okay, you're gonna be more actually, responsible. You can lose your license, and bringing that up too, watch yourself on social media. People have lost jobs, people have lost, or got fired from jobs. I can tell you, you may not get into the nursing program if they can figure this out. And you think you're private, but it's not private. All right. Watch when, and hopefully not drinking and driving, but you get a DUI. I'm going to tell you right now, you're not kicked out of school per se. You can go to, and this happened to students, went through the whole entire program, not here, so went through it the entire program. The NCLEX, or the State Board of Nursing, sorry, they decide if you're going to be allowed to sit for boards. They can say yay or nay. If this on this person, I'm not going to take the DUI, but they're like years apart. She wasn't allowed to sit. She completed all her schooling. She cannot sit for boards. Now, I don't know why they do it that way. I think they should just tell her. But so you have to be, you're in a profession much different than maybe, I don't want to pick any profession out, but maybe business or, these people's lives are in your hands. Okay, so if I write an order wrong and the pharmacist doesn't catch it and you don't catch it, think about how you're going to feel, even just knowing you gave the wrong dose or the wrong drug. I mean, just the emotional component of it. And COVID, I mean, you haven't seen anything yet.
Oh, no, did you have a question? Well, not a question, but I'm wondering, students have some questions for you, especially for the current nursing students. I told them to think of some questions.
Oh, yes. We love questions.
And we also just talk.
Yeah.
Me and Dr. Weaver will talk.
And they're usually quite talkative, so don't let this, it might be intimidated, but don't.
I don't think scared enough.
All right.
And you guys will buy uniforms, things like that.
Yeah.
Right? Hold off on your stethoscope, so you might have stethoscopes out. I just want to say that.
Questions? Yes.
How long does it take you to get accepted into the nursing? Like, when do you actually know, like, the next semester?
You'll know before.
We both applied in the fall last year. Applications were due. I'm from Kansas. I am not from this side of the country. So I had gone home for Christmas, had been home for probably 2.5, almost 3 weeks before I found out that I had gotten into the program. But you'll know like mid-December.
Yeah, and I'm on the committee, one of the committee, one of 4. Right? And I'm on one of that committee that looks at it. So it depends on when they actually meet.
You'll get your email.
So
Find
we'll
out.
have plenty of time to like get all the other stuff done.
Oh,
Yep.
yeah.
And so you bring up a good point. There's a lot of other stuff that happens once you're admitted in, right? You have, they'll send you information about something called My Castle Branch. And Castle Branch, is where all of your immunization forms that you have to fill out from McLeod or for MUSC, all of that stuff is all housed there.
Background check and drug test.
Yep.
I'm gonna put that one out there. You have to drug test to continue on with the program. I don't know if
And
it's,
pass.
I don't know if it's a yearly thing. I know you have to upload
No,
one.
it's not a yearly thing, but if we feel that something's going on, we can randomly.
Yep.
This is TV test too.
Yes.
Yeah.
Those are fun.
You can do the TB test or you can do the quantiferon gold, which is the blood draw.
I
So
will say though, if y'all are applying in the fall and you found out during Christmas break, you have less time than somebody that would be applying in the spring and have the whole summer. So once you get that email, I would start making doctor's appointments and everything to make sure my immunizations are up. 'Cause I am a procrastinator and you will get a clinical warning for not having that stuff in. So, I mean, they're kind of easy with you your first time in, but
Yeah.
I would still try to have that stuff in as soon as possible.
If your parents have your shot records, 'cause like I know my shot record was not up to date. It did not have like my second dose of Tdap. It did not have a couple other like immunizations that I would have gotten as like a 10-year-old. So as a 21-year-old going into the doctor's office, they were like, yeah, you need 5 shots to walk out of here. So this card is normal. If your parents have your immunization cards, have them go ahead and look at it, because if it's not documented, you can do that right now. And as long as it's documented, you can upload it. But that's one thing that you can kind of do in advance that I wish I would have known about in advance, so I didn't have to go in one day and get.
try doing that 20 years later,
Yeah.
whenever your, and your pediatric doctor is dead and that practice is closed.
When it comes to the scrubs, I
Here's
will
my
put this out
stuff.
there. For a health assessment lab, that is Wednesdays and you're in there for about 3.5, 4 hours. You can wear whatever scrubs you want. So if you get in, like I got in, I was like, oh my gosh, yeah, I get to go buy scrubs now. Like I'm so excited. So I went out and bought my own set of scrubs to wear to health assessment. You will order your uniform, so your blue pants and your white your white scrub top and your jacket when you get back in the spring. That's not like, we didn't get to do a try on. I know there have been classes before ours that got to try on the pants and the tops to see if it fits. We didn't get that with COVID. So I broke out my little cloth tape measure and took all my measurements so I could size them. I know we have switched to the Grey's Anatomy tops for sure. I'm not sure about pants. I also just went to a Scrubs and Beyond and tried on scrubs and was like, okay, so I'm a relatively tall person. Scrubs do not come in longs unless you order them online, which is kind of the moral of the story for a lot of pants. Get longs because short scrubs are not a good look. But go to your scrub once you find out that you get in, go to the Scrubs and Beyond in your town and just try on so you have a rough idea of what size you might want.
Make
Oh,
sure.
yeah, and the
you
two
actually
IDs.
measure, 'cause this is your money you're spending.
If it
I
doesn't
ended up with
fit,
some scrub pants that were 2 sizes too big, so. Yeah, not buying anymore, so I got what I got.
and I will say you have to wear all white shoes. And when they say all white, they mean all white. I'm gonna pick on you because you have mostly white shoes on, but even though they're like the tongue and there's a little bit of color, won't work. I wear tennis shoes for mine because the clogs that you can buy, the little foam ones, did not work for me the first semester, but it took me all summer to find all white tennis shoes in a store. So that could also be something to go ahead and start looking for when you get into the program.
And if you're clumsy, I would recommend buying t-shirts, because they are white. I'm clumsy.
I have 2 of everything. So.
Well,
Yeah.
yeah, especially because you have 2 clinical days.
Yeah.
Yeah, once you we have 2 clinical days right now. I didn't buy 2 shirts last semester just because I was like, oh, I only have 1 day of clinical. I don't need an extra shirt. I ordered one with the new order that just went out. So
So they don't have to be limited.
no, your shoes don't have to be anything but all white, or they have to have like a heel and they have to have a closed toe. But I just know like with tennis shoes, it can be hard to find white shoes that don't have like colored accents. So that's like the biggest thing with doing tennis shoes.
Here's the thing about that though. You're in the hospital and your first year, your first semester, you're gonna be cleaning out colostomy bags. Colostomy bags. You're gonna be cleaning out urine bags. You're gonna be cleaning things. You're gonna be cleaning up blood. Is it harder to get blood out of cloth tennis shoes than it is off of leather? Absolutely.
That's why I carry a Tide.
Or leather, yeah.
I carry a Tide to go pen in my backpack at every clinic I'm at. I also bought Scotch Guard and sprayed the heck out of my shoes with the hopes that nothing gets on them. And so far, I have been very good and I haven't gotten anything on my shoes
I
yet.
think
So.
in peroxide gets out blood really well.
Yes.
It does.
Yes, it does. That's what I used to use on the sidelines.
Any athletes? Okay, so Kenneth is,
I was an athlete. It worked out that I wore my softball shirt today. Yeah, I transferred here last fall, played softball last year, did nursing. It was not for me. It was softball is also a spring sport, so the majority and the bulk of my season was in the spring when I started school and when I started nursing, and it was not for me. So I decided at the end of the season last year that I wasn't going to continue this year, and so far I have been much happier, a lot less stressed out. The scheduling, it was just a lot for me to go from, weights starting at 6:15 to class at 8:30 to 11:30, an hour to eat lunch, get my clothes for practice, to a 2.5, 3-hour lecture in the afternoon, and then going to practice. So
That's not to say you can't do it.
yeah,
Yeah, you know Dorie Weaver, she's on basketball, that's my teammate.
okay,
And she had to like miss a whole week of practice because of the coach.
yeah,
that
it's
name sounds familiar.
Dorie, yeah.
it was not for me.
You do?
Yes.
It was
took me a
not.
She
second. I
was
was
very
like,
stressed out last week.
Yeah, we have a soccer player there right now.
We have there's a couple soccer players. I know there's a volleyball player that's a senior one.
Some
Like I
softball
said-
player, there's a senior one and senior
No,
two.
she's not that one. Like I said, it's not for me. It wasn't for me. I just
Tennis, Hunter.
Does
softball.
anybody in here work?
Got full-time
That's a
jobs.
very good question.
Excellent question.
Yeah, last semester, I just knew I was gonna be able to work 30 hours a week and still do.
No.
I thought you said you did.
I tried, I did
So,
try. I ended up,
Some people can,
Very few.
some people
Yeah.
can, but just know that it, as she said, it's rigorous, y'all. It is rigorous. I was blessed enough to have a whole career beforehand, set up a little bit of money so that I can do this and not have to have a job. Last semester I did have a job. But this semester I don't. I
And it's
decided
such
to
a
not.
job, but honestly, I wouldn't. do
Definitely
more than,
reduce hours if
like,
you
16
are.
hours a week.
Yeah.
I mean, you can do it, it's just my problem is I like to have a social life. And so the free time that I did, and you only have like minimal free time. The free time that I did have, I was spending at work. And even the free time I didn't have, I was spending at work, so.
I have a close friend that's already in nursing person, but she told me like the first day, y'all said not to work 15 hours.
Yeah.
I only work 15 hours a week, so it's like a 2-hour shift a day.
I said 16.
So she was like, you're gonna have to like keep it down. I'm like, I can't, I have to work.
And we get that. I
would
mean, of
find a
course.
different job than work time.
I do 15 this semester and it's a little better. Just, I would say have a job where your manager understands, like, even if you put me on the schedule this week, if I have an exam or if I have stuff coming up and I'm not prepared, I can't come in. And my manager, she's understanding. She
And that
understands
helps a lot.
As I said, junior twos, we have Monday, right now, we have Monday and Friday off. Also Sunday, right? So is there time to work? Absolutely, there is. But now what you have to do is you have to juggle, right? There are people who are parents as well. And they're parents, and people have done this before us. People have done this before you. People will do this forever. So like,
How you make
we're
it
just
work.
here to kind of give you advice and kind of set the stage for you. And are we setting kind of a dark stage?
Yeah.
Little bit. But here's the deal. If we make it worse,
Yeah.
yeah, if we make it worse for you, then it's not as bad. How was what?
How many people do they admit?
Fall, we,
For us, it was 50,
Yeah,
it
it was like
was 54.
yeah,
Or
it's,
something
yeah,
like
it's,
that?
it's more than that.
It seems like a lot,
It's
but
like, I mean, we had,
Or 60.
80 some. Fall, we actually bring in more. Spring, we bring in less. Spring, I think we cap it like 60.
I have one last question. Now we're probably gonna have a lot of questions, like you the information, and I know they got classes to go to.
Yes.
Who is their contact person? It used to be Robin Moore, who is it now?
Kelly, Kevin.
Catherine, okay.
Yeah.
I will make sure to get that information to you, so that these are liaison, so I'll do that question, especially the application process, but thank you, everyone, so much.
See you guys soon.
Y'all can talk to any of us either too.
Yeah.
So
Thank you so much.
I was up here telling, well, wishing the junior ones too. So I was like, I know exactly where you're at. Calm down.
I wanted to share with them that I did pass money the first time, and I was trying to freak out because I had a 78, like it was serious, but it was that serious. I guess stop this. Let's see. I hope it recorded.